One of the key things for us as an organisation is to help facilitate social distancing for our staff. It's to maintain their safety, the safety of our patients, and the safety of their families when they go home from work in the evening or whatever stage they go home. What we wanted to talk about today then was social distancing, and particularly the experiences of two of our colleagues, Conor, one of our Unison representatives, and Seamus from PCSS, who have both had different experiences over the last number of weeks in relation to COVID-19, and it's really just to highlight the importance of social distancing. And then maybe I'll provide an opportunity to give some examples of how our managers and our staff can actually work together to ensure we can maintain the safety of each and every one of us as a team. Seamus, can I hand over to you?
You can, Shirley. I'm actually pleased with this opportunity to share what's been my experience to date with this in terms of social isolating. My journey is that I did have an exposure to a case that was known to be positive. And whilst initially I didn't have any symptoms for a period of time, I did over a weekend develop some intermittent symptoms which got progressively worse, and I ended up essentially having a test through one of our testing pods. And from the point that I had the test, then it was very clear that I was in a self-isolating situation. Thankfully the test results came through rapidly quickly, and I got my test result the following day, and whilst pleased to report that my test was negative, in terms of I still had some symptoms, so obviously the self-isolating situation still applied to me, so I continued to remain at home self-isolating for a couple of extra days until those symptoms had alleviated. I suppose having first-hand experience of the requirement to do that, it reinforced to me the importance of social distancing during that period of self-isolation, and how important it is in terms of protecting both myself and the colleagues that I work with. And I suppose it's not until you're actually in that situation that you realise how significant that contribution is, even though it doesn't seem in itself an awful lot to do, but it certainly is highly important. And on return to work, then we looked at obviously some of our housing arrangements in terms of how our offices were occupied and stuff to reinforce the social distancing requirements in the workplace.
Yeah. And Conor, what about you from your experience, a similar experience?
Oh yeah, Catherine, a few weeks ago I tested positive for it, and at the beginning there was largely no symptoms, and it was just over a weekend developed a dry cough and everything that was sort of out there symptomatic with it. I started to develop those symptoms and self-isolated, stayed at home. After a few days it was pretty rough in regards to how I was feeling, but after the 7th day, it was, thanks to the NHS and the Belfast Trust, I was able to get tested. And I got tested here in one of the pods, and the staff were fantastic in regards to treating you, and got the result the next day and was positive, and self-isolated again for another 7 days. And as I say, I've working closely with our colleagues in occupational health, got to go ahead to come back to work, which was great. So thankfully got through it okay and back to work. But it did emphasise, as you were saying, Seamus and Catherine, the whole issue around self-isolation is absolutely essential, but now we're in a whole different phase where we work in a hospital, and we understand that it is difficult for social distance and so forth, but we really want to get the message out there to staff that they try everything they can to make sure they maintain social distancing in all of our areas and our working environments, nursing stations, canteens. We all just really try our best and work together. We know it's difficult, but we really need to practice what we preach. As healthcare workers, we are telling the public to make sure that they socially distance and respect those rules, and it's important that we adhere to those rules as well.
Yeah, absolutely.
Conor, that was really helpful and powerful, I suppose, and it's important to hear those messages from our teams and our staff that have come through that situation. So I suppose for us practically, what can we do, and how can we support our managers and support each other and work together to actually practice social distancing? So a number of different things that we can do. Make sure that when we're using our canteens, when we're leaving work in the evenings, that people do change out of their scrubs, change out of their uniforms, because you're protecting yourself, you're protecting the public, and also protecting your families. But also in terms of our workspaces, been very mindful of, that we are maintaining that 2 metre distance. alternating our shift patterns and our working patterns if that's possible, working from home if that can be facilitated in as much as we can, reducing the footfall into some of our premises and facilities as best we can so that all of our staff can have the opportunity to feel safe, because we are an essential service and our staff are all key workers, but that they feel safe and we can maintain their safety within the workplace.
Yeah, absolutely. I think it's essential that from a union perspective, from a Unison perspective, we're putting it out there to our reps and our colleagues right across the Belfast Trust that they work together in partnership and trying to achieve the social distancing in their workplaces, and that means making reasonable adjustments where you can. It's not always easy in regards to place where you work, but it's important that people communicate, they talk, and they work it out together and try the best they can to maintain that social distancing in the workplace. And as I say, we have a really good partnership here with the Trust, and we want to maintain that through this difficult period. And the only way, as collectively, I suppose, as a society and as a workforce, we're going to get through this is about close collaboration, close working together. And ironically, that close working together means being apart.
Yeah.
So, as I say, it's important that we continue to practice what we preach.
Yeah, it's a lot about behaviours and the way we're just sitting here this afternoon about this. And certainly, from my perspective, we've always had the technology in the Trust, but we've been forced into teleconferencing, team meetings, and it's probably technology we've had there for a while, but the current situation has made us use that, and that in very many respects it's been very useful when you've had need to communicate or have meetings and discussions in relation to things.
So I suppose from all of our perspective, we would always encourage our staff, and that's our managers and our staff, to work really closely together, because you know your work environment and you know how to maintain safety within that local work environment. But I mean, if you can't, or if you feel that you're not getting a response, or you feel that you're not being listened to, again, encourage you to speak to your local trade union representatives or come through to ourselves in HR. Drop us an email to the Ask HR email address, and we can work with you and local managers to try and come up with new and innovative ways so that we can ensure all of our staff are kept safe in the workplace.